Hi everyone, Dr. Alex Ritza here, downtown Toronto chiropractor, and I hope everyone's enjoying this beautiful day we have outside. So today, episode 8 of Lunch and Learns with me, and we're going to talk a little bit about and continue and finish our 3-part series on examinations. So as a recap, so far we've talked about how to tell if you're healthy and what examinations to use, and how it is very difficult to tell if you're healthy by how you look and how you feel, and that's generally a bad indicator. We also have talked about different imaging methods. We've talked about how x-rays are really good at looking at the outline of bones and to tell if the bone itself is really healthy, and can give us a little bit of information about the actual structure of the bone, but beyond that they're not good at telling us much more, and don't give us a good indication of why somebody might have a particular pain or a particular condition. We talked about ultrasound and how that's really good and cheap and efficient at looking at the peripheral joints like the shoulder and the hip and the knee and the toes, to figuring out maybe if there's a soft tissue injury with that particular joint. We also talked about how MRIs generally are not good and are kind of a waste of money for taking a look at the spine. They show us really good detail of the structures within the body, but don't often tell us why there's a particular problem. And the example we used is, 30% or 1/3 of people that go in for an MRI will have a disc bulge or a disc herniation, will have no symptoms. So does that disc bulge or disc herniation matter? Depends how you look at things. So today what I want to talk about, what I think is the most important and the best test or tests for figuring out why your X hurts or why you have a problem with your body. And so what this is going to talk about, or what we're going to chat about today, is a lot of what we do in the office in our Functional NeuroStructural Examination, which we think is the benchmark for examining the physical structure of the body and measuring how healthy you are physically, and seeing how else it's affecting your health in some ways that you know why you're coming in, and some ways that you don't know. So in terms of examining the body and the spine to figuring out if it's healthy, what I think is really important is, first off, is assessing your structure. So in our office, I'm going to move that. So in our office we do a digital structural analysis. We take postural photos. We see if you are all stacked up in your posture or if your spine is shifted. And we know from the research studies that if your spine is shifted, it can have effects on your health other than just how you look. There are many studies showing that it can go on to affect a lot of physiological function, ranging from the heart and lungs to hormone production. We also know that if you have a 2-inch forward anterior spinal distortion, or your head comes forward 2 inches, you might have a core problem with your spine. We know in a previous episode we talked about the sledgehammer leaning forward and how much more the head can weigh as it comes forward, and that change in structure has a tremendous change in function and change in your health. So that's how we measure structure in our office. And while an X-ray and an MRI can kind of show structure, they don't do it globally. They look at either in the X-ray just the bones, or an MRI it can't look at your structure. You're lying down in a little narrow tube and it's really claustrophobic and not so fun. So the next part of the examination we do, which I think is a benchmark, is you have to measure the function of the body. So in our office we have a couple function tests. We do a dynamic squat analysis, we do a dynamic shoulder flexion test, and these two tests combined can show us how the joints are moving together in the spine and globally. We know the squat's probably, and especially the deep overhead squat, is like the best test for assessing if there's a joint or stability problem somewhere in the body. It's not always going to tell you the why, but it will show you exactly where something might be off and how it might need to be corrected. And same thing with the shoulder flexion test. It's a really great test for us where we can assess how the core and the upper body are working together, and if the two can work independently, and if your shoulder is healthy and functional. Part of that, we also do our advanced mobility testing, where we see somebody's ability to take their joints through a full range of motion and do it stably. This is a requirement for health. If you can't move all your joints through their full range of motion, you are not healthy, unfortunately. The joints are meant to move through their full range of motion, and as they go unused or get injured, we lose that, and that's how you slowly move down towards that path of whether it's arthritis or degeneration or just stiffness. Your joints need to move through their full range So of course we test that. In terms of our functional neurostructural examination, we also test a lot of nervous system components of the body. Nervous system is the most important organ in the body. You know, if you can have a heart transplant, a kidney transplant, you can regrow the liver, but if you have a damaged nervous system, you cannot be healthy. If you don't have a nervous system that functions at its best, you will not be healthy. So we do a really good job of assessing nervous system function. We do this in a number of ways. The ways that people are often most interested is how it's affecting your muscle function. If you have stress on a nerve, is the muscle going to be stronger or weaker? Yeah, it'll be weaker. So by doing our advanced neural drive muscle testing, which you might think of strength analysis, we can see what nerves or potentially what muscles are being stressed or inhibited, and how that relates back to either a change in structure in the body or irritation on a particular nerve. And this gives us some really important information of what changes need to be made in your lifestyle and maybe in your body to make sure that all your muscles are firing as best they can and are as strong as they can. I think everyone would totally agree that you have to have strong muscles in order to be healthy, and that's why, you know, part of our core curriculum is ensuring that we talk about lifting heavy things. As well as doing our nervous system analysis, we do a couple other cool tests. We do heart rate variability, we measure our heart rate, we do blood pressure, and a test we recently introduced is spirometry, where we're measuring lung function and really seeing some cool results where people are showing, you know, increased lung function or increased lung capacity through our care. And it's not because we're treating lung function, it's because, you know, if people are standing taller, their posture's improved, and they're getting better nervous system signals to the lungs, they're getting improved lung function, which is a really nice side effect of care that we're not shooting for, but is one of those things that when you measure it afterwards, it's really exciting. In terms of structure, it's also cool to see people getting taller. Are we adding actual height to them? No, but when you're standing more upright and you see an inch taller than when you first came in, that's a really exciting result. So next time that you have something that you need testing for, you know, you have a back pain or a knee pain, I hope that some of this information is really useful and you can maybe pick the right test. But, you know, the problem being that an X-ray or an MRI or ultrasound doesn't show you the why. It often doesn't even tell you the why X is painful, because we've seen lots of patients with an irritated meniscus or a torn this or torn that, and we found out that, you know, a core problem in their spine and nervous system was actually contributing more to that particular pain than what the X-ray or the MRI or the ultrasound has shown in the past. So it's really important to do exceptional testing and have a really good analysis and a review of it. Simply having an X-ray done and then your doctor sending you the X-ray report is not enough to understand what is actually going on in the why, which, you know, at our office we're all about fixing core problems with the spine and nervous system and uncovering the why, as opposed to you know, traditional care, which is just Band-Aid solutions. So again, I hope this was helpful. If you think that you need a more advanced analysis and examination like the one we're talking about, just send us a private message on Facebook. We'd be happy to get back to you. And if there are any specific concerns or comments, just leave them below. I'd love to start a comment chain. But otherwise, have an amazing week. Weather is good, and enjoy the roads.